Good afternoon, friends. Today I would like to give some information about the commonly occurring illness, that is with fever. Fever is the most important and also most commonly occurring illnesses of people. And if we see about 10 patients in a day, at least 3 to 4 patients will have fever. Fever is of most commonly occurring illness. Well, because fever is not a disease, fever is the symptom or sign of some other disease. We will have to find out while treating the patient. How we come to the conclusion, the type of fever, nature of fever, whether it is continuous fever or intermittent fever or chronic low grade fever, and whether the fever is associated with anything like cough, cold, loose motion, vomiting, or neck rigidity, and also epileptic fits. May give rise to epilepsy also. Patient may come with high fever with children. Normally children get high fever and they get convulsions or fits. So all these things, associated things of a fever, whether it is associated, whether systematic infection is there the cause. And fever may be due to viral fevers, viral infection or bacterial infection or protozoal infection or any of the chronic ailments like tuberculosis of low grade fever of long duration or acute fever of viral infection. Most of the times fever due to viral infections is a self-limited one, usually 3 to 5 days. Normally the patients will be worried the fever has not come down since 1 day or 2 days or 3 days. Normally up to 5 days we feel if there is no detectable infection on examination, we put the blame on viral fever, and also viral fever and reassurance will be most important, and continuation of medication for controlling the fever. And once we see a patient is fever, we'll have to, after seeing the examination, after seeing the patient in detail, and systemic examination of nasal sinuses, respiratory illnesses, and also lungs disorders, and also whether there is any abdominal signs or symptoms on examination. After a detailed history, we start examining the patient with the fever, and from head to toe we examine in detail and to get some clue whether there is any infection in the body as a attributable cause of fever. And once we complete the examination, we will have a certain idea of some investigations of this patient before we start the medication. Normally, thinking that it is viral infection, we do not advise investigations on the first 2-3 days unless there is indication of on examination. So normally after 2-3 days, if the fever continues, we would like to examine or investigate the patient under these heads. Normally the blood tests are done, urine tests are done, X-ray examination is done, and ultrasound examination is also done to come nearer to the diagnosis after examination of the patient and history taking. And normally blood examination is done to know the blood counts. Normally we do this, we call it as CBC, complete blood count, which indicates the count and details of the white blood cell count, red cell count, and erythrocyte sedimentation rate, platelet counts, and all these various cellular components of the blood. So in all these things we come to the conclusion whether it is a viral infection or bacterial infection. In viral infections, normally the WBC count will not be raised, whereas in bacterial infections, normally all the white blood cell counts and neutrophils, like that is, they are the soldiers of the body to fight infection. They are secreted in more number to fight the infection caused by the bacteria. Whereas in viruses, the white blood cell count remains same, neutrophils also will not alter, and in cases of dengue fever, normally the platelet count comes down, whereas all other things will be normal. So decreasing platelet count, we have to put the blame on dengue fever. It is a type of virus infection. So, and ESR is raised. ESR is increasing low grade fever of long standing duration or chronic infection. Maybe normally cause will be tuberculosis of the lungs or tuberculosis of the lymph nodes, like that. And urine also can give rise to some can give information about certain illnesses caused by the urinary tract infection or kidney infection or bladder wall infection. Then what there is albumin, normally the albumin or protein is not lost in the urine. Whenever you come across urine showing the presence of albumin, it indicates there is infection. Then we will also be given information about bacterial infection, bacteria, or any mucus threads or mucus scars, or whether red blood cells are there in the urine, that indicating of higher upper urinary tract infection or lower urinary tract infection. So depending upon the investigation findings of urine, it may give infection, and we will have to change the antibiotic after culture and sensitivity test report of the urine infection. Then some other cases of fever, we may advise certain X-ray findings investigation for the investigation. That is, suppose if the person is having some acute headache and other things, along with the fever and nasal congestion, nasal blocking, we may be advising investigation paranasal sinuses X-rays to know whether there is any inflammation or infection in the sinus cavities, maxillary sinus, frontal sinus. They can give X-rays, can give some information. Okay. And apart from X-rays of chest can be advised whenever the patient is having cough, congestion, wheezing, and respiratory infection, chronic infection like tuberculosis, or acute illness like pneumonia and other things. So X-ray of chest will be useful to understand whether there is any infection in the lungs as the cause of fever. And other thing investigation may be non-invasive investigation, ultrasound examination of the abdomen and pelvic organs can be done to rule out the causes of fever, whether it is due to liver disease or kidney disease, or spleen enlargement is there, or hepatosplenomegaly, liver and spleen both are enlarged, to rule out typhoid, parotid, malaria, and urinary tract infection, and also whether there is any intestinal infection after you examine, if necessary, the stool examination also will be done to know whether there are any intestinal worm infestation. So all these things can be known. And fever, if it is due to cholecystitis or any gallbladder disease or calculus or stones in the gallbladder or kidneys or urinary tract, we can come to know by simple investigation like ultrasound scan of the abdomen. Okay. Then after all these investigations, we may not come to any conclusion about the cause of fever or cause of the disease which is the illness which is causing the fever. In such cases, we normally call it where the cause is not known, where the cause is not yet identified or recognized, we call it as a fever of unknown origin. We call it the FUO, fever of unknown origin. In those cases, we have to control the fever, treat accordingly, whether it is viral, bacterial, or any infectious diseases. Then ultimately, probably even if all these things do not rule out the investigation, rule out the cause of fever, or come to the conclusion about the fever, we normally call it as PUO. PUO also we have to be treating with just like any other fever. If necessary, normally fever, paracetamol or crocin like medicine, paracetamol, acetaminophen, usually paracetamol drug or dolo or any of the kalpa or doro, crocin, any of these medicine containing paracetamol will be useful to control the fever. Fever can be controlled with frequent doses of this anti-fever medicine. That also will be giving relief from the aches and pains of the body. So fever will be associated with the headache, body pain, backache, low back pain, joint pain, and other things. That also will be relieved by this paracetamol-like medicine. Okay, that also has to be given frequently, about once in 3 to 4 hours, and also along with the medicine for fever, body pain, and headache, we have to also continue to give more liquids like more rehydration to be given, because because of the fever, sweating might be there, and there may be loss of body water by way of loose motion, vomiting, or also excess of urine passing. So we have to be giving lot of nutritious food, and also encourage the patient to take more liquids along with fever medicine. And according to the investigation report that will come across, any positive finding about the illness causing the fever, we will have to treat with proper right antibiotic for a right antibiotic course of duration till the fever comes, settles down. That is all about the fever. Don't get worried when the fever continues for 1, 2 or 3 days. There are medicines, there are investigations. Don't get panicky, but see that patient is given medicine for fever, medicine for body pain, headache and other things. Give comfort to the patient. Give more liquids and other things. And tepid sponging also has to be done when the fever doesn't come down with the medicine. If the fever is more 103, 104 degree Fahrenheit, then the patient is likely to get convulsions and fits. That is why we have to use the tepid sponging. Tepid sponging is the method which will bring down the fever much more faster than the medicine given for the fever. That is, take a towel, make it wet with cold wet towel. Entire body to be washed with a cold wet towel from toe to head, and put on the fan for either 1 or 2 low fire output, so that the evaporation takes place after sponging. Then the fever will come down within about 10-15 minutes only. So then the medicine will be starting. Medicine also has been given. That will also take care of the fever continuation. Tepid sponging also has to be done once in 4-5 hours, just like you give medicine for fever once in 4-5 hours. This is all about fever. And regarding the antibiotic coverage and other things for various types of fever, it is very difficult to cover in the talk like this. This is only information about fever and